2 medical workers, a doctor and a nurse, have tested positive for COVID-19. The two who are attached to Lira Hospital are the first health workers to contract the virus since the country registered its first case on 21st March. They've been part of the medical team treating truck drivers who have been referred to Lira Regional Referral Hospital after testing positive for COVID-19. The two health workers have since been transferred from Lira Hospital for further treatment. The doctor has been transferred to Mulago Hospital and the nurse to Entebbe Grade B Hospital. While confirming the cases, Robina Nabbanja, the State Minister of Health for General Duties, said government was doing all it can to protect its health workers.
It is true. We have got some of our health staff who got contracted during the course of duty. I want to encourage our health staff to remain focused, to remain sober, to also think, we have to continue giving service to our people. The PPEs are there. If these were staff from lower health centers, that could be understandable. But like I told you before, we have equipped regional referral hospitals. At least they have PPEs, they have sanitizers, they have everything. It could be because of maybe laxity. It could also be because maybe they moved out. Maybe they did not get infected in the hospital. You never know.
The Lira District Health Officer says they haven't registered any community case, thus there is no way the health workers could have contracted it from outside the hospital premises.
News is that within Lira District we have not registered any community transmission as far as COVID-19 is concerned. It is still limited within this setting, and whereas we have registered some 2 community transmission of our staff who have been in the treatment center attending to these patients. Fortunately, they were already under quarantine at that time.
The isolation unit is an isolation unit. It is fenced off. It is completely separate, and the health workers who are conducting this work also do not mix with the other health workers. They have a separate accommodation. They don't go back to their wards, and don't go back to their homes. They stay in this accommodation which is specific for them.
Dr. Ekwaro Obuku, the former president of the Uganda Medical Association, has attributed the cases to the failure by the ministry to provide adequate personal protective equipment for the frontline health workers.
This is very sad because the conditions under which doctors and nurses are working are not protected. This includes the outpatients departments, but also in theatre. As I've mentioned yesterday, 22 pregnant mothers who deserve to go to theatre for operation at Kawempe Hospital were not operated because what to use, including masks, were absent. Over 30,000 healthcare professionals globally have been infected with COVID. In Africa, there are probably 2,500 now, according to the WHO report. Over 1,500 have died. What more does government need to understand? Do they need to see a Ugandan doctor and a nurse dying first for them to understand that it's important to invest in the hospitals where the risks are highest and probably the points of entry in the borders? That is where we should put our resources.
Uganda's tally of COVID-19 cases now stands at 417, with the total number of frontline health workers who have been tested positive for the COVID-19 virus standing at 7. Olivia Komgisha, NTV News.